Fellow Kenyans, welcome to our daily briefing on the current status of coronavirus disease. Today, our cumulative figure of those who have tested positive to the COVID-19 stands at 535 people. This is because out of the 1,077 samples tested, some 45 people have turned positive. This, of course, is the highest number recorded in 24 hours ever since the first case on the 12th of March. Out of this number, 29 are from Nairobi, 11 are from Mombasa, while 5 are from Wajir, and 1 is a foreign national from Somalia. The 5 from Wajir have a history of recent travel to Mogadishu. In terms of gender, we have 30 males and 15 females. Also, on a positive note, I also want to add that today we have recorded 9 new discharges. This brings the total number of those who have recovered, turned from positive to negative, to 182. But more importantly, today, I also want to point out the cumulative distribution of in some 3 key areas. The first one is Eastleigh. The 29 cases that you have heard which are from Nairobi are all from Eastleigh. That means that as we speak, there are 63 cases within the Eastleigh area alone. That tells you then that there is community spread happening within Nairobi, specifically in the area of Eastleigh. This comes out of the result of mass testing in that area within the last 24 hours. Kawangware continues also to be an area of concern, and there are 24 in that area. And then in Mombasa, as the trend, you have been hearing the trend in Mombasa, in Old Town, in Mombasa Old Town alone, we now have 39 cases. Fellow Kenyans, this tells us that in those areas, in the area of Kawangware, in the area of Eastleigh, in the area of Old Town Mombasa, that we need to take action in those particular areas. And we are in the process today of consultation with the respective authorities in those counties so that we can determine what action we are going to take. As we reported in our daily briefs, we continue to observe behavior and practices which stigmatize persons who have either contacted or recovered from the disease. Let me say this. There is not a single person who is immune to the virus. Not one person. You are as likely to have it as I am. And therefore, nobody should be stigmatized because of the fact that they actually contacted the disease, or they were suspected. And in fact, ladies and gentlemen, I can tell you of a case where a lady who is a member of a choir, of a church choir to boot, wanted to sing with the choir, and because she was positive and had turned negative, people in the choir were suspicious about whether she should be in the choir or not. Now, I think we should be a bit more generous than that, and I think that that idea that somebody is a bad person or somebody is going to pass it to you is not a good thing, and we should not look at it that way. And if you remember, it used to be the case also with HIV when we started. So because anybody can get it, I think what we should have is a lot of understanding. What we should have is a lot of empathy and sympathy so that we do not discriminate against parts of our society. Let me remind you, and I quote, and this is the case we are seeing today, that whoever heeds discipline shows the way to life. But whoever ignores correction leads others astray. That is in the Bible, Proverbs 10:17. The reason I am quoting this verse, fellow Kenyans, is because the figures that we are hearing today are a clear demonstration that things are not getting better. And people who are telling others that things are better are lying to them. And somehow, somewhere along the line, we seem to have come to the conclusion as a society that things have gone back to normal. Today's figures show things are far, far from normal. Things are very challenging. And those who are exhibiting the indiscipline that I've referred to, leading others astray, are becoming a common phenomenon. You will remember that 2 weeks ago or so, His Excellency the President de-escalated measures to do with hotels and eateries. You have all seen for yourselves, the media, even people in the media have been calling me and telling me you can see the abuse that people are exhibiting in the eateries and in the hotels. We give certain protocols, and clearly a lot of people are not following those protocols. Yet there are those who are assisting us. There are those who are observing these measures. There are young men and young women working back